Hi, everybody. So I'm Ellie from Wildfire Nutrition, and thank you for joining me today. What I wanted to talk about is why I chose the GI EcologiX for my clinical practice, a little bit about what to look for in a gut test, and running you through some of the common mistakes that people make when they're thinking about testing. So the Invivo GI EcologiX gastrointestinal health and microbiome profile is really the hero product of a lab that's here in Bristol. And we know sort of from working closely with Invivo that they really go to town on the science behind their testing. So microbiome research is very fast paced. And so we need to be quite humble about the science, and we really need to invest in the research. And so, when you're working with a testing company, that they need to do that work. And, if you're researching gut testing, or if you're thinking about gut testing for the first time, you need to know that behind that testing company, there are microbiology professors, biotech or medical microbiologists. And when you work with Invivo, that their lab team has decades of experience in the field. And you also have the assurance that they are approved by the Care Quality Commission, CQC laboratory, and that laboratory is certified, so that they are held to the same standards as GPs and hospitals in the UK. So there's a recognized standard of quality behind that testing. So another reason why I enjoy working with Invivo is their integrity. They're a certified B Corp, and they are carbon neutral, and they really believe in sort of nothing should come at the expense of our environment, but also just uncompromising adherence to the science. So the integrity is there. And if you work with a company that's sort of all about big offers and things like that, you might not get that same level of care. So that brings us to clinical utility or usefulness. So I always say, when people are asking me, when they come to my clinic and they want to know about testing, the only reason to test is if you can do something useful with the results. And that might sound obvious, but if you have the resources and you're really interested to know what's going on in your body, and you can do that, that's great. But more often than not, we really want to be making the best use of our funds. We want to invest in our health, but we also want to know that this is going to work for us. So the markers in the GI EcologiX are all chronic disease related. And this is what we as nutritionists predominantly see in patients. So we're working with conditions that are chronic. So maybe there's asthma or autoimmunity, or maybe you've had a skin condition for a long time, or something that you've really been experiencing for maybe like 3 months or even a year, 5 years. This is a long-lasting condition. So this really complements the healthcare system that we have access to in the UK. And what we always recommend is that you inform your GP of any symptoms that you have, just in case. So you know they've made any necessary investigations. If there's a diagnosis to be made, that's in hand. And then you can work with your nutritionist and you can do the testing, and then you know that you're covering both bases. So it's not one or the other. And so the reason why the EcologiX is so reliable is that the markers all have robust science behind them, and we're looking at human clinical data, so studies or accurate methodologies. Any marker that didn't pass their validation process was removed. They have all sorts of markers in that test, and I'll go into that perhaps in another video. But you know, they've included bacteria related to the health of the gut lining, and that's so that we can understand the health of the gut barrier and the mucous membrane. So lots of people now talk about leaky gut, but this really is more about the permeability, the inflammation, what kind of bacteria are there? Are there SIBO bacteria? Is there H. pylori? And we also have the assurance that the confirmation marker for H. pylori is the same as the one that's run within the NHS. So the standard is there. And then the other thing to look for in a gut test is that it gives you information about your host health markers. So that sounds a little bit strange, thinking of yourself as the host, but there are so many bacteria inside the human body that really, they are the majority and we are the host. So common errors that people make are, you know, falling for offers and things like that. And, you know, maybe the testing company isn't working with professionals. Maybe they're just selling to the general public. So, you know, with Invivo that they work with professional, qualified registered nutritionists and other UK healthcare professionals. So this is a professional standard test. This test relies on your healthcare professional really having that training and knowledge to be able to guide you through the test results. The test, it requires a little more translation and understanding of microbial patterns. So you need to be sure that you work with a trusted practitioner and you know that they can guide you through your results. You also know when a company works with professionals that they undergo rigorous clinical and research methodology. They're continually under scrutiny and investigation by trained professionals. So we're looking at the research all the time as nutritionists and, you know, as you know, people who really have a lot of clinical experience in this field. So there's a really high standard of education. And when we're interpreting the results, a common mistake is to look at microbes that appear high or low and to try and add or remove. And when people do or try to interpret their test results themselves, this is what I see. So often there's a fixation on something that we think shouldn't be there and we're trying to get rid of it. It's much better to approach the case from an individual perspective looking at a full case history, what the environment's like, way of eating, and so on. So this is how nutritionists work, so that we can understand how the microbes and the person's health markers could be related to symptoms. So there's a bit of detective work that goes alongside this, and we can't separate the person from the test results. So that's really what I wanted to say about the EcologiX. There's a science behind it, there's clinical utility behind it, and above all, this is a company with integrity. So that's why I've chosen to offer the GI EcologiX to my clients. And if you have any questions, as always, you can message me or email me, and I look forward to hearing from you.